Hello, welcome to the Northamptonshire Wellbeing Programme. My name is Harriet Agarofide. I'm a consultant medical oncologist at Northampton General Hospital, and we will be discussing endocrine therapy and why management of side effects is important. We know that when hormone therapy is chosen, there are various preparations and different treatment plans that are being recommended, and we know that one size does not fit all. The treatment plan is usually based on the ovarian function, the characteristics of the tumor, the side effects that we might anticipate, and obviously patient's preference. Regardless of the preparation chosen and the duration of treatment, which can vary between 5 and 10 years, we know that these drugs have an impact on quality of life. Most commonly, what we discuss in clinic are issues related to the higher risk of bone thinning and osteoporosis, as postmenopausal women are expected to have a higher risk when they are offered aromatase inhibitors. What we tend to do is have investigations to assess the bone density, and that is with a bone density scan, and based on the results we have recommendations to supplement the calcium and vitamin D intake, or sometimes to consider further treatment like bisphosphonates. However, we don't discuss in clinic things like menopausal symptoms, weight gain, and fatigue, but all these are significant side effects that impact quality of life, and the management of these needs to be considered based on severity. We will start with the hot flushes that are caused by the decreased level of estrogen that impacts on the body's thermostat, the hypothalamus. And we know there are contributing factors like alcohol, spicy food, stress, and exposure to heat. And in managing these side effects, we know that we have the triggers that we could avoid once we identify them. There are some practical measures that can be considered, but if these are not enough, we could also consider some medication, antidepressant drugs, for example, in low doses that may help regulate the body's thermostat and may help with the management of the hot flushes. Therefore, we would encourage patients to discuss these hot flushes, if they are severe, with the GP, and based on the discussion of risks and benefits of these preparations, hopefully solutions can be found for quality of life not to be impacted by these side effects. Another important topic that is rarely addressed in clinic relates to sex and intimacy, and part of that is caused by the low estrogen levels, which we expect on endocrine therapy that we recommend for the treatment of breast cancer. However, there is more to this, and we know that the body image changes post-surgical treatment may also interfere with sex and intimacy. There are also issues with vaginal dryness that can be managed with moisturizers and lubricants, and we would recommend a discussion about these with the breast care nursing team, the GP, the practice nurse, as solutions could be considered for this important aspect of life after breast cancer. Another important issue is weight gain, and this is not something that we consider from an aesthetic point of view. We know that overall maintaining a healthy weight is important for long-term health. However, on top of this, there seems to be indicators that a healthy body weight contributes to better outcomes following a diagnosis of breast cancer. In previous studies that were done, when they've looked at the risk of distant relapse of cancer, they could see that the higher the body mass index, there seemed to be a higher risk of distant cancer spread. And again, this was observed in a different trial when they looked at various endocrine therapy used alone or in combination, we can see that the higher the body mass index, the higher the risk of recurrence seems to be. Therefore, maintaining a healthy weight can be seen as another intervention that could potentially improve outcomes after a diagnosis of breast cancer. There are various ways to achieve a healthy weight, and there is no one solution that suits everyone. The GPs and the practice nurses can offer more information on achieving a healthy body weight, or if needed, they can organize a referral to a dietitian for further advice. Another important symptom that comes with menopause and following treatment for breast cancer and is also related to endocrine treatment is fatigue. This may be also related to a sleep disruption caused by hot flushes, and the intervention that was shown to be beneficial in this situation was regular physical exercise. Not only this helps with fatigue, but there also seems to be a lower risk of breast cancer mortality in patients who are regularly active. Therefore, managing the weight and managing fatigue with lifestyle modifications can be seen as an intervention to improve outcomes following breast cancer, and more information on these lifestyle modifications can be found on the NHS Change for Life website. In conclusion, in terms of managing side effects of endocrine therapy optimally, we know that this helps with adherence to treatment, because treatment is a long-term treatment that tends to last from 5 to 10 years. So it is important for individual patients to be able to continue with their medication. However, quality of life is equally important, and the lifestyle modification that are considered for managing the side effects of endocrine treatment are also interventions that may help improve outcomes and reduce the risk of cancer recurrence. So overall, we know this is the treatment goal of hormone treatment. Thank you for watching.